One day at the Denver Zoo, the zookeepers noticed that their king cobra was moving a little weird. They found a bulge and they thought, "Ooh, what's going on here?" They take the snake, put it to sleep, anesthesia, whatnot. They biopsy the bulge. So a biopsy is when they take a needle, put it in, take a little sample. Sometimes they might even have to cut out a little sample, and they send it to the lab, and they found out that the king cobra had cancer, a lymphosarcoma. Now, luckily, there was a treatment for it. The trick was, how do you give cancer treatment, whether it's chemo or immunotherapy, to an animal, especially an animal that might bite you and you don't want that from a king cobra? So the part that confused me originally is, if you could put the snake to sleep, why not give it an infusion or an injection of the chemotherapy that you would need to give? But for whatever reason, the chemo they chose might have only come in a pill form. So they had to figure out, how do you give a pill to a snake? It's actually a solution similar to how we give pills to humans who have a hard time swallowing. So if you can't swallow a pill for whatever reason, sometimes we put the pill in applesauce or in pudding so that when it goes down, it's smoother, it's kind of mixed in with other things. The applesauce for the snake was a rat. They put the pill inside a rat, and then they had the snake consume the rat within minutes. My first question is, if the rat is taking the pill, wouldn't the rat digest it? And then wouldn't that affect how much of the actual chemo gets into the snake? Apparently, no. Apparently, if you do it within a few minutes, you put the pill into the rat and the snake consumes it, either the pill hasn't been digested by the rat, or even if the pill has been digested and it's in the bloodstream of the rat, when the snake consumes it, it still gets that effect because it's still in the rat's bloodstream. I'm learning about all these incredible discoveries we make in animals that then get translated into humans, and it makes me think how much we had neglected veterinary medicine in medical school. Because again, this is the foundation. The crossovers between animals and humans, huge. I kind of wish med schools took this more seriously.